Hi everyone, and welcome to the High Impact Medicine podcast. In each episode of these series, we talk to a medical professional who is pursuing what they consider to be an impactful career alongside or learning from their previous clinical experience. We will discuss their journey from med school, the impact of their work, and their advice for anyone interested in going into the same area. Today we're joined by Jan Brauner. Jan is a PhD candidate in the Center for Doctoral Training on Intelligent and Autonomous Machines and Systems and a member of the Future of Humanity Institute's DPhil Scholars Program. His current research interests include AI safety, applications of AI in medicine and biomedical research, and clinical research on cognitive enhancements. Before his DPhil, Jan studied medicine in Germany and worked as a research assistant in neuroscience, immunology, and global health. Jan, thank you for joining us today.
Well, yeah, it's a pleasure to be here. My first podcast.
Well, Jan, I think it would be really helpful for some of our listeners to know if you could tell us a little bit about your journey from med school and what got you interested in this idea of impact and doing good.
So I always wanted to use my career to make the world a better place. I kind of didn't see the purpose in having a career that doesn't do that. So after high school, I thought, who helps people? Doctors help people. And so I studied medicine. And then while studying, I did a lot of research on the side parallel to med school. And also I worked a lot in medical refugee help and volunteering in this area. So yeah, and that was my vision of where I wanted to go with my career. I was probably thinking Doctors Without Borders. I also explored quite a bit in helping people without health insurance in Germany and kind of this area. And then I eventually kind of halfway through med school came across effective altruism. Just really by luck stumbled across it. And for me, this was immediately, wow, these are really good ideas. And I've kind of always been thinking like this, but just never really applied it to impact and to doing good. And so I was pretty convinced by this, but this was quite a few years ago. And back then, effective altruism, the long-termism part of it wasn't so prominent and was quite a bit more about global health and about earning to give. And so that's first what I explored during med school. So I did some elective placements in high earning specialties. In Germany, that, for example, would be orthopedics or something like that, to see if I have a fit for that and for earning to give. And I also did a 4 months elective placement, the last placement in med school in tropical medicine and global health, and also shifted my research more into the global health direction. So I was working on HIV drug resistance in Tanzania. Yeah. And so that's what I did during med school. All of the time during med school, because I was always doing several things at the same time. So I was studying, but I was also really doing quite a lot of just biomedical research and doing this refugee work. I never had that much time to really think in detail about my career, but I guess I'm kind of the type of person who likes to think about stuff in detail. So I was really happy after med school that I was I'm going to take 1 month or 2 months off and just think about what I want to do with my career. And then these 1 or 2 months spiraled into a much longer period in which I was reading just a lot of about a lot of the effective altruism literature, but also about philosophy and ethics. Yeah, and kind of really spent a long time thinking about what I should do next with my career. So I became personally pretty convinced about long-termism relatively early on. Just made a lot of sense to me that this is maybe one of the most impactful things we can do, is trying to steer the long-term future of Earth originating life into a positive trajectory. But then obviously what you do, even if you start from that premise, is very unclear what this implies for your career. And so I just read a lot, thought about this a lot, talked to many people. I also freelanced a bit on cost prioritization research. And then at the end I had this long list of various things that I think would be a good fit. And obviously, with my medical background, various biosecurity roles were on that list, but also other things. And then I sent this to many people and got feedback I mean, it was a good process overall. I overdid it a bit, so I think it spent like 1 year before I started the next thing, and I think half a year would really have been enough to gain all the knowledge and get like enough certainty in my next path.
I think it's important. I think that in medicine in particular, there's a big pressure to kind of go from med school, then straight into junior doctor, then straight into training. You kind of have to progress along each step. And I think it's really important what you just said. You took out some time to figure out exactly what you want, do some research and figure out where could I potentially be most impactful and where do I see myself working. During that time, did you ever feel like any pressure to work into medicine, or did you feel really happy exploring and taking your time out?
Yeah, it's a great question. So I would say there was definitely like pressure from myself, basically. So I was definitely pressuring myself, especially because I hadn't planned on taking like so much time off. I really had planned on this only to be like 2 months or something like that. And then I think I still don't know what I want to do. It's going to be another month, and it's going to be another month. And I think I also had like some ideas about what people might think about this, or like, all my friends from med school, they're all like they already like finished the first year of the residency. But in fact, whenever I talked to them, my friends from med school was definitely like, they were more like thinking, oh man, Jan, you're really doing cool stuff, right? You're just in the hospital. Yeah. And it was never like this, I never got this, oh, what are you doing with your life thing? I will say it was definitely more challenging with my family, my parents in particular. I don't think my parents till today still fundamentally don't understand why I didn't become a clinician, basically, why I didn't work clinically, because it's like, why would you throw away something like this? Is what is in their mind, yeah. And there's also this thing that I really liked clinical medicine, so I never work as a full clinician, but in med school in Germany, you do spend roughly like 2 years in hospitals, and the last year is entirely spent in hospitals. And so I got probably a bit of a rosy image of what it is like to work as a clinician, but I still got like a fairly good image. And I can say that for me personally, it's just a really very satisfying job. And then so there was definitely a feeling of sacrifice, of like, oh, I really like treating patients and it's so fulfilling, and now I'm like giving this away, sacrificing this so I can pursue options which I think are like higher impact. I was like in 2 minds about this, right? I also really, really want to do the stuff that is high impact. It's not like somebody's forcing me to do it. It's me who wants to do that. But at the same time, it still felt like, but it's such a fulfilling job that would make me so happy. And well, I think there are like various things also correlated with this, right? So in the end, I decided to train up in machine learning, and then I started a master's degree in machine learning. And then you're a bit more starting from beginning a bit more, right? It's like you're in a master's degree with people who are a couple of years younger than you on average, and there are clearly skills that you don't have at the beginning, so you have to like catch up on those. And this was all challenging, but I can definitely say that now, a couple of years later, I love my job. I freaking love my job, and it really worked out super well, and I do not have this feeling of sacrifice anymore at all. Yes. So maybe it's true that like you can actually find enjoyment in a lot of things.
Yeah.
And I guess it comes over time, some certainty comes, some like successes in what you're doing and so on. And so now I don't feel like sad about not seeing patients at all. But there were definitely like a year or two where this was like a bit on my mind. Mm-hmm.
Yeah, I completely agree with that. And when you said, your family didn't quite understand it, that resonated really strongly with me, because I know for me, it's my mom who says, oh, when you're a doctor, you get to treat someone, you get to treat their infection, you get to heal their fracture. And the work you're doing sounds great, but you don't get to do that in the same way. And she just still to this day doesn't really understand it. And that's hard when, the people around you might not necessarily exactly understand exactly what you're doing. It can make it a little bit harder to justify to yourself. But I think over the last year, have felt a lot more strong and confident in it, and exactly like yourself, have no regrets about it. So it's great to hear you say that.
Well, it's great to hear from you as well. I feel like once you gain like more confidence in what you're doing yourself, then also if like other people are maybe a bit skeptical, then it's just less affects you less or something like that.
Yeah, exactly. And then I think you feel more confident in talking about it, and that confidence I think comes across as well, right? I wanted to pick on one thing you said. So you said, you had this period of exploration and you decided you wanted to go back to study to do some machine learning AI stuff, and you did the master's program. How did you find going from medicine back to school and to where you are today? Do you feel like you were starting from scratch, or do you feel like your medicine degree helped you in some way to where you are today?
Yeah, so I mean, this is a great question. So it's definitely not starting from scratch, but it's unclear whether it's really like, to a large degree, like the medicine degree itself. I guess like any degree would maybe help, or like any challenging degree. So there's definitely a difference in like, I don't know, work ethics or like ambition, or it's just like how organized you are and so on. That it's just, I think for many people, probably different. Or changes once they get a bit older and get like more professional experience. And then with research, I mean, I had done a lot of research, and there are definitely transferable skills that transfer from like biomedical research to statistics and machine learning research that I'm doing these days. But obviously there's also many things you have to learn, the maths, the coding, and yeah. I mean, I had various reasons for thinking that this machine learning thing would be a good idea for me personally, which will not apply to many or most medical doctors. I mean, yeah, I had already coded quite a bit just next to studying. Some of my research had been in bioinformatics. I had taken first year maths courses at uni anyway, and so on. So yeah, I had one foot already in this direction. There are a couple of examples, I would say, in the effective altruism community of doctors who pivot to doing machine learning and AI safety research. I think everybody had some re-education or did at least like a master's degree or something, or nearly everybody, yes.
So, in terms of thinking about doctors who might be suited to machine learning and AI safety work, what do you think the characteristics of some of them might be? You mentioned one, that you had a strong interest in statistics and coding. What other things do you think are, some ingredients that might predict someone who's likely to be interested in this area?
It's like computer science and maths. This has to be a thing, I guess. Yeah. So maybe as an aside, so like the area that I hope to work more during the rest of my PhD, it really is the intersection between AI alignment and working with humans and like large-scale human experiments and trials, basically, because there is definitely a large overlap. So, I mean, very roughly, AI alignment means getting AI systems to do the things that we want them to do. And yeah, for that, we need to extract the thing that we actually want to do. And current AI systems need a lot of data. So you need like a lot of data on what we actually want to do. So one example is, you want to create an AI system which can summarize longer articles with a short summary. Then if you want to do this with current deep learning systems, you have to get a lot of feedback. So 10,000 and maybe 100,000 summaries read by humans and then ranked. I like the summary. I like this and that aspect about the summary. So, and that is actually, so this somewhat ties in with work I have done anyway in the past in clinical trials, where it's like, it's pretty logistical. It's basically mostly a logistical challenge. And you have to just really think through every step and ask yourself, with this question in the survey, am I really asking for the thing I'm asking for, or will I actually get a different answer, or the participants will perceive the question to be different than what I actually want, and so on, which is pretty similar to clinical trial research in medicine that I've done. So there's definitely this niche, and so I'm trying to go more into this direction.
Yeah, and that kind of relates to my next question. And I know this is a hard one in advance, but where do you see yourself in 5 years? What do you ideally want to be working on?
Yeah, so basically probably pretty much this, something AI safety, AI alignment with human participants. This is definitely an up and coming, growing field. Yeah, ideally I would like to be an academic, so a professor somewhere, or maybe I'll try to to my own research startup or non-profit startup in this field.
Yeah, of course. Is there any advice that you would give to medical students or junior doctors in general who perhaps are thinking about impact in their careers and are thinking about maybe taking a step back from clinical medicine? What advice would you give, regardless of what they're interested in?
So it depends on your country, I guess, but like one advice is you can always go back. At least I personally can always go back. I think that's how it is in Germany.
Yeah.
So I could still practice clinical medicine now if I wanted. So yeah, and at least in Germany, there's really not that there's a lack of doctors. So I would definitely get a job as a clinician if I wanted to. And maybe this is actually similar in many countries. So this is actually not that risky to experiment a bit. That's what you're interested in.
I think this is a great privilege that we have, right? Where I think as doctors, we have this opportunity to perhaps take a little bit of time off. And because doctors in most places are in reasonably high demand, there should be an option to return back to medicine, which is a great position to be in, and means that if you are interested, I think, in exploring something else, then you should give yourself the time to do that, because the risk of it, as you just said, is not too high. Yeah,
and there are really many exciting things that one can do. Basically, I think maybe also for the listeners familiar with the effective altruism community, then they will definitely heard about 80,000 hours and the career advice on that from that organization. And so they are and these things are great. So like the priority career paths and biosecurity and alternative protein and so on, but there are also many other things that can be really useful, and it's actually quite good for a community to have quite a diversity in skills. So one example that I quickly want to talk about is the following. So just after my transition to machine learning, I think when I was in my master's degree, I saw from a member of the effective altruism community a Facebook post where the person said, well, we really need somebody to replicate this trial that was done 15 years ago on the cognitive effects of creatine. So there has been a trial 15 years ago that showed if you take creatine, or if vegetarians supplement creatine, then they get a lot smarter and their cognitive performance increases a lot, which would be such an important result if it is true. Especially because creatine is routinely taken by so many athletes, and nearly everyone who goes to the gym takes creatine, and it's very, very few very few side effects. And basically this was like a call for proposals. If you are able to run this trial, then let me know and I'll give you money, right? And so I had read about this trial a couple of years before, and I was furious at the time that, nobody looked into this for 15 years after the trial. And so I felt like a strong personal motivation to be that's it. Yeah. I'm gonna call on my network, call a couple of friends who work in psychiatry and see if we can start something. And then in the end, we ended up running this trial with me as as the supervisor, in collaboration with some university hospital in Germany. And then more opportunities came up for other high impact trials that also and so basically now I have a small lab in Germany, which is running clinical trials, and I'm the supervisor on it, and it's 2 to 3 people full time. And the reason I'm telling this is that I'm kind of doing this in my spare time, and it's kind of not ideal, basically. So the trials are going fine, but seriously, there are mistakes happening that would not happen if I was doing this full time. And it's kind of weird that I'm kind of apparently the best person to do this, or at least, back then this was the case. And I continue asking around a bit and continue to ask around to find other people interested in this type of work. But so far I haven't found anyone who could fill this role, but it's kind of certified impactful work, because it gets all the funding is from the effective altruism community and so on. So and this kind of shows you this lack of diversity a bit. We have several medical doctors that I know right now who are doing machine learning, but I don't know a single one who could take on mid-scale clinical trials in mental health or cognitive enhancement. And I don't know. I think there's currently EA project into building a new vaccine against COVID and to doing this like really fast and so on. And I also know that this project is really, really trying to hire people who have some experience with running clinical trials and is struggling. And they certainly wouldn't struggle to hire people with experience in machine learning. Let's just say it like that. I don't know what the lesson here is. The lesson is not that everybody do clinical trials, but the lesson is a bit more, there are really unexpected like benefits to diversity and skill sets. And that means, if you, for example, have like one path which you think, this generally seems like higher impact, but you have another path which maybe seems like generally a bit lower impact, but is also very rare in the EA community, and where you have a great opportunity right now, then that is one argument to consider the second path.
Yeah, I think when you were saying that, what stuck out to me was there might be a beaten track or an established route you can go down that has impact, but in fact, if you just follow perhaps what you're interested in or things that might be particularly neglected, there might emerge a really, significant scope for you to find or be really impactful later on. So you shouldn't necessarily feel like you have to go down something that people before you have done. You can carve out your own kind of area, and it's likely that potentially in the future that could be quite useful.
Yeah, that's a great way to put it, I would say. And I think this is hard, basically. It's maybe a bit easier to do things where you're like kind of more sure about what you're doing and why you're doing it. But then again, that is the reason why many people are doing these kind of more well-trodden paths, right? And so if you happen to be a person for whom it would be like easy to do something which maybe not that as many people are doing, or like walk your own path, then I would say by all means do that. Yeah,
I think that's great advice. Yeah, thank you so much for joining us, Jan. I think a great discussion. Thank you for sharing your journey from med school, what you're doing now, and for giving all your advice. Much appreciated.
Yeah, it was a great pleasure. Thanks so much.